Okay, but a little detour from that. Let's go back to one big thing you should know, hypertension. And again, hypertension is high blood pressure. In your Martini book, I think they still use this value for 140/90. And actually, when I reread the section on OpenStax, they actually used the 2017, so they did update the guidelines. And what happened, just like in my previous lecture, is that they lowered the threshold by 10 millimeters mercury in both the systolic and diastolic. So I think for this class, this is what probably the last year I'll use this 140/90 systolic and diastolic. But next, probably in 2000, if you're watching this in 2022, is that we're going to use this new guidelines right here. Unless they change it again, then I have to record this whole lecture. But what we have with hypertension, so complications of hypertension, well, you can get, if you have increased pressure on a blood vessel and you have a weak spot, what can that do? Well, if you have a weak spot in the blood vessel, it can cause that part of the blood vessel to bulge. And if it ruptures, then you can get hemorrhage wherever that aneurysm is. You can also have heart failure. So the interesting thing is that hypertension is very tough on your cardiovascular system. If you have like a lot of, if your heart has to work harder, well, it's going to damage your heart over time, and that can affect its function and efficiency in pumping blood to the rest of your body. And kidney disease. So your kidneys filter blood and they make urine out of it. Thing is that what if you start slamming your kidneys with too much pressure over an extended period of time? Well, that can cause the kidneys to accumulate damage and also impair their functioning as well. Vision problems. What if you start to increase the pressure in the sensitive tissues around your eye or the vessels in your eye? Well, that can cause the cells around them to die as well. And ventricular hypertrophy. So again, this is what we have with the normal heart. And what do you notice about this heart? Notice that this ventricle is getting super muscular. So say you have a lot of pressure everywhere in your heart. Well, thing is, like, what if like you're trying to open a door and your friend's on the other side pushing back on the door? What do you have to do? You have to add more pressure, right? So this is why the heart is really bulking up over here. Because if there's a lot of pressure already and a lot of resistance in your systemic circulation, it's going to try to bulk up, and this is what we have with this pathological ventricular hypertrophy. And then, so what we also, and a big complication of hypertension is that you have damage to vessel walls and arteriosclerosis. And we're going to cover that really, really quick. Yeah, so let's see. Oh, good question. I know they just changed the value to classify hypertension, but if someone has other health risks, shouldn't they treat or monitor hypertension earlier as well? And yes, especially if someone has obesity or has an obese BMI, or especially if they have diabetes or any sort of heart disease, they should definitely. That's why they always try to monitor your blood pressure, because we find that the three are often linked. Is too much coffee bad for you since it can cause hypertension? Well, thing is that you can actually, this is something you can probably do if you have like a automatic BP cuff, is like, well, take it before you have a coffee and then have the coffee and then take your blood pressure after. But are you still going to have elevated hypertension after that? Probably not, right? So when we're talking about this hypertension, it's more of a chronic hypertension. So things like maybe if you're just done with a workout, if you just had a lot of or if you're taking like pre-workout, yeah, you're probably going to have hypertension. But are you going to have hypertension for the rest of your life? This is why it's important to kind of like monitor hypertension, your blood pressure, but also have multiple readings and notice if there's an overall trend, like, hey, I didn't have coffee, I didn't work out, I didn't just have a lot of like salty kimchi and drank a lot of water to cause all this water retention. So this is why hypertension is more, when we're talking about this pathological hypertension, we're talking about like a long-term thing.